It is just a huge honor for me today to have Dennis Hartlieb in my home. My gosh, he completed his undergraduate in dental school studies at the University of Michigan. Is that a Wolverine?
Go Blue.
Go Blue. University of Michigan School of Dentistry, 1988. He maintains a full-time practice in the Chicago suburb of Glenview, Illinois, focusing on aesthetic and restorative treatment. He is an instructor at the Center for Aesthetic Excellence in Chicago and is an Adjunct Associate Professor at the Marquette University School of Dentistry in Milwaukee, Wisconsin. He's a member of the American Academy of Restorative Dentistry, the American Dental Association, the American College of Dentists, the American Academy of Dental Sleep Medicine, and is an accredited member of the American Academy of Cosmetic Dentistry. He is also accreditation examiner for the American Academy of Cosmetic Dentistry. But I want to thank you. You've been teaching courses, lecture and hands-on for how many years?
25.
And I've been a dentist 30 years. You graduated in 88.
Me too. So I started teaching before I knew anything.
Yeah. And when I was getting my FAGD, I needed lectures.
Right. And
to get a lot of my deals, I took so many of your courses. But then after the 500 hours of lecture for your FAGD, the MAGD was 600 hours, but 400 hours were hands-on.
Yep.
Well, you can't even find 25 hours of hands-on denture courses. Right. So I took some of your courses, like in Chicago, then I take it at Yankee. Yep. I took some of your, but you're an amazing instructor. You personally taught me a lot over the years. And I hope someday you raise the credibility of Dental Town by building us an online CE course, because just having your name on the masthead would be amazing.
Thank you very much. That's very nice.
So thank you for all that you've done for dentistry. And so what are you passionate about today? What's got you excited?
So, like I said, I've been teaching dentistry 25 years, doing hands-on programs for 20 years. What I've come to really understand is that when we're learning hands-on, when I'm teaching hands-on, there's a huge bell curve in how people learn. And when people come in and take these courses, they're spending thousands and thousands of dollars. What really was hurting my heart was I see people who are not getting their value out of taking these courses. They're away from their home, they've shut down their practice, they're losing money, and they're spending money wanting to learn these techniques, and they're not getting it. They're too far behind the 8 ball, and they're not understanding the information. I wanted to find a way to slow it down for them and make it affordable.
Now, are these the guys that during dental school were sitting in the back half of the class?
No, that was me. I was in the back.
Were these the gunners in the front 3 rows?
Well, I think it's interesting. No, I think it's so interesting is that people have developed certain skills and they learn at a different pace, right? Some people get it right away. I'm someone I got to hear it over and over and over. And one of the frustrating things for me is when I'm learning, if someone's racing to the next topic and I haven't really sort of gotten that thing, I'm like writing down notes. It's like, what the hell did you just say? Because I'm still writing down something. So I wanted to create a system where people could learn at their pace, because I'm not the fastest learner, and I know people learn all across the spectrum. So I decided I wanted to create a system where I could send people not only video on how to do technique, but actually the same hands-on courses that I'm teaching live, they can do in the privacy of their own practice at the pace that they want to do at a fraction of the price of going to an online course.
So how do you teach that hands-on online?
Yeah, so I have it broken down into
because that's what you're saying
segments.
You've accomplished, right?
Yep. So what I do is the first portion of the program will be a lecture. So if we're going to talk about class 4 composite, I'll have a PowerPoint presentation on breaking it down step by step. If you're using self-etchers, this is how to use them better. If you're using a total etch technique, what does that mean? If you want to do a selective etch, I'll sort of explain all that type of stuff, how to make your adhesives work better, and then go through the concepts of layering techniques. If you're only doing nanofills, this is how you do it. If you're going to be using a microfill, this is how you layer that. So there's a huge lecture portion. Then there's a sort of a self-assessment test. Make sure that you got the information, make sure you understand it. And what's great about this is they're broken down in these short little modules, 2 to 3 minutes, right? So you're working on your patient, you got time, anesthetic time. Come down, you crank out a couple of these little modules, right? Or let's say you can't remember, like, all right, what did he say about self-etch? You can go to the module on self-etch, and you don't have to go all the way through an hour-long video to find that point. You just click right on that module, and that'll refresh your memory for you. After you go through that, I've done the same technique that you're going to do in the privacy of your own home through a microscope. So I send you the tooth model, the materials. We're sponsored by
Restorative. Oh, you're sending them a package that goes to the course?
With the course. The same thing that I'm doing.
I don't think I've ever heard anyone, I've never heard anyone say that in my life. This is the first I've even thought, duh.
Everyone we've brought this to, so Brassler's one of our partners, BioHorizons Implants, one of our partners, Cosmetic's going to partner with us. So everyone I've spoken to about this, it's been a brand new concept for all of them.
Damn, that's amazing. I've never
you.
even thought of that. And the minute you said that, I'm like, oh my God, that is so
Makes so much
obvious.
sense, right?
That is so obvious.
Because people want to get their experience.
Can I steal your idea?
Well, I know people are going to, so we
want
want to do this with everybody. I know this is how to train dentists. I know this at the bottom of my heart. This is how you have to train dentists.
Is it hard working with Brassler? Because every time you work with Brassler, you have sad thoughts of missing Peter Brassler who passed away.
Well,
there was no wilder guy you could go to dinner with after a convention than Peter Brassler in Savannah, Georgia. That guy, is this disrespectful to say he could drink you under the table and still have? I mean, he was so fun. I miss that guy so much.
You know, I think
is that a fair assessment, or is that bad?
I've only heard stories, so
they're all true, and they all gave you the G-rated version. He was so fun.
That's I think one of the things that I've really enjoyed in things that I never expected from dentistry, and I bet you'll say the same thing, is the people you've got to meet and the times, the experiences you've gotten to share. They're invaluable. I mean, I never anticipated being able to have so much fun with people. I was just with Jeff Rouse. Jeff Rouse does all the sleep stuff, right? And he was talking that, you know, if he wants to go have a drink with a buddy in San Antonio or in Seattle, there's one or two people he can call. But in Chicago, he's got a whole bunch of people, because we've met all these people around the world that you can just pick up a phone and say, hey, I'm in town, let's go have a drink. And I've made all these connections that I just never imagined.
And you said you were at BioHorizons out of Alabama, Birmingham, Alabama. That was another mind-blowing thing. I remember the first time I went there, my God, that I didn't realize. You think Alabama, deep south, cotton fields. Mm-hmm. My God, that's where they built the space shuttle, solid rocket fuel busters. I mean, it was like...
There's some brilliant people down there, right? It
was like the Silicon Valley of the South.
Yep.
I mean, some of the most intense engineers I've ever met in my life are down in that region.
Yeah, I got a patient down there working for Mercedes, and there's a real brain cluster down there.
And you mentioned Cosmetic. You have a deep history with Cosmetic. Didn't you and Buddy Moppert, weren't you partners for a couple decades?
So I joined Buddy 20 years ago in his practice. I was doing my dentistry in Chicago, and I wanted to move out into the suburbs where my family was, and I wanted to reduce my commute, and I needed to change the practice. The practice I was in a very blue-collar neighborhood, and I had gone through Frank Spear stuff and Dawson stuff, and wonderful patients, but they really could not afford to do the dentistry that I wanted to do, right? And nothing against that. I came from a very blue-collar background, so nothing against that, but I wanted to do a type of dentistry that they couldn't afford. So Mopper was looking to bring somebody in to do that type of dentistry that I wanted to be doing. So I joined his practice. It's a really interesting story. When I joined Buddy, I told him, I said, look, I don't believe in composites. They don't work in my hands. I have very little faith in composites. And he was great, very gracious. He said, you know what, why don't you come in and spend a day with our practice and see what we're about, see what you think. It was an event that changed my life, because it was truly the first time in my life where I realized that I didn't know shit. That I thought I knew so much, and I watched him do his bonding, and I said, you know what, Dennis, you gotta recalibrate. And now I look at the world completely different. When people offer opportunities and think about things, I'll say, you know what, I don't know, so let's be open to it. I watched Buddy sit down and do his direct resin bonding stuff, and it's changed my dentistry, and it's changed me professionally and personally. And so it was really something.
And he started out as a pediatric dentist.
Right, yeah.
So how do you go from being a pediatric dentist to a rock star, Academy of Cosmetic Dentistry?
Cosmetic dentist, right?
How do you go from being a pediatric dentist to one of the top rock stars in cosmetic dentistry?
Well, Buddy was a phenomenally talented dentist, and so... he was doing all these fracture repairs on kids and bonding back in the 70s. He was doing diastomal closures on these kids. And the moms of these kids would come in and say, you know, Dr. Mopper, my dentist wants to do a PFM crown on my front tooth because it's broken. And, you know, you think back to the 70s what the PFM crowns looked like, you know, holy shit, right? And Buddy, so they're begging Buddy, would you please bond my tooth? So Buddy's a master's in pediatrics, and I think reluctantly over time he finally succumbed to the pressure and he started bonding the teeth.
Because legally, technically, the boards don't even want you to do that.
Exactly, right?
There
You're
was,
supposed to be doing
remember that
kids.
huge lawsuit that went all the way to the Supreme Court, I forget, in the South somewhere. Was it Arkansas? Because the orthodontist wanted to have a hygienist.
Right.
And he's like, why can't I have hygienists? And the board said, because you can't. It's in the state board. And So
Buddy started treating the parents of these kids and started closing spaces and started fixing fractures. And all of a sudden he starts veneering teeth and bonding. This is sort of the same time when porcelain veneers were first coming out. And Buddy really designed a system with composites that gave you excellent aesthetics, great function, and it was immediate. Anyone who's done porcelain veneers, everyone's got the same story, right? You take someone from ugly teeth, you put on provisionals that make them look better, and all of a sudden you got to start delivering the porcelain veneers, and all of a sudden they're going, I like my temporaries better, right? The temporaries weren't better, it's just that you got used to their temporaries. And what's great about bonding is it's immediate. And so, I may not be able to do resin veneers that are as great as some of these wonderful ceramists in the world, but you know what? Ugly teeth, they're looking pretty decent in one visit, and they're thrilled.
Now, how many children do you have?
I got one daughter.
You got one daughter. Here's my deal is when your actions don't match your words. If I had a daughter, and I had to pick between filing down the enamel on all of her front teeth and doing 10 veneers versus sitting down and not touching her enamel and doing direct bonding, what would I do?
Oh, no doubt, right? Hands down.
And these young millennials don't understand. They get out and they think, I'll shave it down, do veneers. But tell them the truth. You've been doing this for 30 years.
Yep.
If you take someone on just the average, mean, median, middle bill curve, do a case of veneers where you reduce enamel and bond on, 20 years later, how many of those veneers had to be retreated? What does that look like 20 years later?
For resin or for porcelain?
Porcelain.
Porcelain, I tell
indirect porcelain veneers where you've reduced some enamel.
Yeah, and so the biggest problem is when you're dealing with people who have exposed roots, when you're dealing with loss of enamel and you're bonding to dentin. I mean, the failure rate's significant. Right?
What is that? Try to quantify it at 10 or 20.
You know what? I mean, I just had a woman
in 10 years, how many of those 10 teeth that got veneers now needed a PFM?
Now they need crowns.
How many of those needed a root canal?
I think a significant portion.
I mean, the bottom line is, if you first do no harm.
First do no harm.
So instead of reducing all this stuff, unravel that stuff with clear aligners.
There's no doubt.
And then, because here's what I see with dentists that makes me mad. The daughter comes in and says, Daddy, do that to me. He's like, no.
Right.
You're going to have Invisalign and direct bonding. And then when it's not my daughter, let's numb up your teeth, file everything down, take an impression, send to a lab.
That's absolutely.
That should be your first red flag of an ethics concern. I mean, my sister, my oldest sister's been a cloistered Carmelite monk for 35 years. And she's read every major religion. The oldest ones are Hinduism, then it's like Confucianism, Buddhism, Judaism, Christianity, Islam. And she says there's not a name of a person, place, city, thing. There's nothing that shows up in all major religions except for one line, which is deep plagiarism, the golden rule. Treat other people like you want to be treated. In fact, some of them say, I think it was Judaism, this is the only law that matters, nothing else matters. And my sister says, when you read that, if you were at the university, they'd say, dude, you plagiarized, you stole that from Howard. Look, Howard wrote that, and that's Hinduism, and you wrote that, and that's Buddhism. And that's why she thinks there's a divine player of all the major religions.
Super player.
So when you're a dentist, I mean, it's just so easy. I mean, like a lot of people say, well, would you redo the root canal and the crown, or would you extract the tooth and do an implant? Well, stop. What would you do if it was your mouth? It's so easy. Just what would you do if it was you?
Well, and I think
what would you do if it was your daughter?
And I think the other thing, why I like being able to do direct resin is that I can give the patient the option, right? Because I'm not in their shoes, and I tell patients this all the time. It's like, here are your two options. I'm going to tell you the advantages and disadvantages. I'm not going to give you a million of them. I'm just going to tell you a few of them. You need to know. If I do it in porcelain, I got to drill more of your tooth structure away. Some patients are totally fine with that. Some patients are like, fine, if it will last longer, then drill more tooth away. I got other patients say, if you don't have to drill my tooth, that's what I want. I don't have to go any further than that, right? So if I can go through, here's option A, here's option B, advantages, disadvantages, what's right for you, I'll do what's right for you as long as it's morally okay for me, right? I'm cool with that. I want them to decide. I don't want to be the person who has to decide for them. I'm not Marcus Welby. I'm not the guy who's going to sit there and tell them what they got to do. Right?
You're giving away your age. You just lost our audience.
Yeah, right. Okay, so anyone
Marcus Welby, they're like Marcus Welby.
Okay, so
what the hell's that?
All right, so
it came on after Gilligan's Island.
I think it relates to what's the medical show that all these millennials watch now?
Grey's Anatomy.
Yeah, Grey's Anatomy. This is the Grey's Anatomy for my generation.
So I always ask my homies, shoot me an email, howard@dentaltown.com. Tell me who you are, how old you are, who you like me to see, what country you're from. They're all under 30.
Yeah, for sure.
25% dental school, 30. The rest are under 30. I get like one old guy a week. By the way, when he was talking about Buddy Mopper, that was podcast 135 if you want to go back there. So how do they find out about getting a package and take an online C course? Do they go to your website?
DOThandson.com.
So what is DOT?
Dental Online Training.
Dental Online Training. That's the dot.
Or
Dental
Department
Online
of Transportation.
And then hands-on training. Yeah, I'm so mad at the Department
hands-on.
of Transportation. Can I tell you my Department of Transportation rant?
You go ahead, tell.
Well, so in Yuma, Arizona, we just lost a child in a pediatric dentist case.
Okay.
And the news is all over it.
Okay.
And I know these homies.
Uh-huh.
The best.
Uh-huh.
Board certified. Standard of care. Everyone's still stumped what the hell happened. And probably if there was an autopsy from hell done, there's probably something unknown about this child's health history.
Right.
Just a class act. But let's look at the government, Department of Transportation. So when they build a 4-lane intersection, it eats and kills a human every month. When they develop all 4 deals. So when they put a Walmart, a Target, and a Kohl's on all 4 centers, once a month, your daughter, my kid, driving the intersection, say, which one is it? Boom. So right up from my office, they kill a person every month. So who is the PhD mechanical civil engineer that designed that intersection?
Right.
And are they going to fix it?
They're not.
Does someone have to die every month for eternity? And if that pediatric dental office or my dental office started killing a kid every month, how long would it be before the government
shut down
shut me
dentistry.
down?
Yeah.
So I want the Department of Transportation to come stand at the corner and tell me how many people have to die per month. It's one a month since I opened my frickin' practice. No one cares. No one talks about it. But that same government, when one of the best pediatric dentists in the state, who does everything right, and loses one human, and RIP, rest her soul, that would be so bad. Oh my God, they're ready to just beat him up.
Yeah, for sure.
But I'd like to put on trial all the civil engineers who design all around Phoenix.
Yep.
Because they know if they put a 20-acre center on just one side of the street.
Yeah.
And then the other side of the street is like apartments and condos or whatever, no one dies.
How interesting.
And you can't have a visual monkey come to an intersection with 4 ways to look.
Right, yeah.
Because when you have an intersection with 40,000 cars a day, it only takes 30 days before someone missed something.
For sure. Yeah.
But anyway, I won't rant on that. But that's a good way to remember. Remember that story? I just ran on Department of Transportation. So that's his website, DOT, which stands for Dental Online Training, hands-on, love it. So how many courses do you have?
So we're going to be introducing with 4 courses, but we're going to be introducing new courses every couple of weeks. We're going to launch at Midwinter Meeting. So
Chicago Midwinter?
Chicago Midwinter.
What is that, February?
February, yeah. So
and you live in Chicago?
I live in Chicago,
yeah. And February, wouldn't you agree that February is the best time to go to Chicago?
Oh, well, the weather's perfect. It's,
God. Chicago in April and May and October and November is the coolest city on earth.
Well, you know why it's in February. I mean, I don't know for sure, but I'm guessing that there was the cheapest rates to get hotel rooms and convention space. So dentists being dentists back 100 years ago, they said, well, let's do it now because now we can get it for the cheap. And so I'm sure that's why it is.
I mean, when you come there from Phoenix, that's a shocking experience.
Listen, I've gone down to the Southwest Dental Conference down in Dallas, and when they held theirs in August. I'm like, what's wrong with this? Let's say we switch this with the Midwinter Meeting. We'll take August, and you guys take
And then
February.
the same meeting people, they would say, Howard, what should we do? Because we've been having dwindling attendance for the last 10 or 15 years because idiots like you are making online CE courses, and they're taking courses online. And I say, well, for starters, like, what's this weekend? Yankee.
Mm-hmm. Yep.
Really, you want to go to Boston in February?
I was so lucky
what
that
was
my
your
flights
next
were on
best
time.
idea?
I tell you, I'm
you
so
just got
lucky.
back from there?
I was there. I flew in last night. I got in at midnight last night.
And how was the weather?
It was, well, I came from Chicago, which was complete crap. So compared to that, it was beautiful because it was only cold without the rain, snow mixed, and just
I think their number one competitor right now is YouTube and online C. I mean, I got friends that learned how to place implants because they came home every night, got on YouTube and just searched dental implant surgery. And they said they just came home, made themselves watch an hour a night. A lot of them did it while they're on a treadmill or a Stairmaster.
Sure.
And you just can't watch an hour of free YouTube videos every day for a year and not learn something about implants.
And I think, look, I don't learn that way. I think it's a great way to learn. I don't learn that way. But I think DOT comes in as a supplement to that. All right, so you've been watching these videos on implants. Now, how about a hands-on program to go with that? So that the first time you sit down, you have the feel of what it feels like to go into bone on a model instead of going right to the mouth.
You know, most dentists come home at 5 o'clock and turn on ESPN and pop a beer.
Yeah.
The guys that are getting on Dental Town and reading this stuff and taking online C courses, they're a cut above the grade, and a lot of them are the 30,000 AGD members, and they're trying to get their fellowship in AGD and their master in AGD. Yep. Will your online hands-on course count as a participation credit?
We believe so. We're working all that. Part of getting part of getting the ADA CERP is you got to be in business for a year in a continuing education format to be able to apply. So we believe we are satisfying all the requirements that it will take to be able to get credit for that because we have feedback. We have the ability to upload photos of treatment that you've done on these models, and I can give feedback, and my team of other dentists that are going to be working with me will be able to say, hey, consider your line angles. This is what we talked about. Go back to Module 2. This is where we talk about line angles. We want you to go back and look at that. Also with a self-assessment test. And there's a discussion panel so we can answer questions, make sure people are getting out of it what they need. Where I think this is going to be super helpful for people who have associates and they have group practices, I believe this is going to be a way for them to be able to calibrate their dentists and make sure that the dentistry that's being done under their name, under their logo, is good quality dentists. Because how do you know how good of a dentistry your associate's doing? How do you know what's going on there? If you're busy working and someone else is working, how do you know what they're doing? This is a good way for them to calibrate. So give us an example.
You said you're working with Brasler, Cosmetic,
BioHorizons.
Like, give us an idea. I want to go through, and you have 4 courses up. Are those the Brasler, Cosmetic, BioHorizons?
Yeah, exactly.
So which one has 2?
So let's see. Well, Brasler's involved in all of them because we're using their burrs for. So we have an anterior contour course. I think if you want to get into doing cosmetic dentistry, the first thing you have to learn is what's a central incisor look like. This is the key, the most salient part of a smile is the shape and contour of a central incisor. So essentially, it's a contour exercise where we have a veneer prep tooth that we send to you. You put on the composite that we send to you. We go through all the things.
Which is the name of this course?
The Central Incisor Contour course, I think it's called.
Man, this is so cool. Well, they say, the bottom line is you want everything faster, easier, higher quality, lower in cost. And these millennials have $250,000 in student loans.
At least.
And every time they want to take a course, they got to get in a jet, fly across the country, stay in a hotel. And your course like this course here, posterior occlusal restorations, $139. Hell, the hotel they stay in is going to cost more than $139. And the airline ticket's going to be on Southwest Airlines is still going to be a couple $100.
Yep.
And then the course you're going to might be $1,000 a day.
Yep.
And what you're doing is you're making it faster, easier, higher quality, lower in cost. And then you have this one course, the maxillary central incisor 2 shape and contour. It's $95.
Right.
Shit, she spent $95 at dinner last night at Macayo's drinking margaritas.
There you go.
And whenever you make it faster, easier, higher quality, cheaper, faster, better, you're onto something. And what you ever watch Shark Tank?
Sure, yeah.
What does Lori Greiner always say? What's her quote? She always says, "If I see it, I mean." She just got to get it right then. What's her catchphrase?
I don't know. I don't know. I mean, I watch it, but I don't.
She's got a catchphrase. It's something about instant recognition of, oh, that's a hot idea. A hero or a zero.
Yep. Mm-hmm.
Lori Greiner always says, I can tell instantly if this product is a hero or a zero the minute you said, I'm mailing you a package of stuff to go with the course. I'm like, that's a hero. God dang. That was so flippin' obvious. 55 years, 30 years in dentistry. First time I heard it. Hats off to you, buddy.
Thank you. Thank you.
Notify our team. We will steal that idea.
I want to be part of it. Look, I think there's...
Well, you can be part of it, man.
Yeah.
I'd love to have you involved in our online CE any way you can.
That'd be great.
Yeah.
Look, I know this is the way to learn. And here's the other thing. Besides the time, the money, all that, I think the biggest issue is at your pace.
Right.
So you can stop the video, you can rewind it, you can watch it again and again. Okay, now I get the idea. When we're doing our techniques and I'm working with a microscope and we have mirrors so you can make it as three-dimensional as possible. I'm showing from all angles. Look, this is how I'm holding my instrument. This is how I want you to spread the composite. Look at it from this angle. Does it look like this, right? Go back. So I'm teaching in the way that I teach when I do my hands-on programs, but they can stop it, they can rewind it, and they can watch as many times as they need to. Do they really feel confident? And so they go into their office and they can literally start doing the dentistry that they want to be doing for their patients.
And what you said is so genius is there's a lot of new research in education, and the more you read about this, the more sad it is for America. When they started the Department of Education, that was the best we ever measured, and it goes down every year. And the politicians can't fix it because if you said, the first thing we need to do is shut down the Department of Education, then you'd be against education. Oh my God. But some of the research is mind-blowing. Like even in middle school, a child cannot take in information and learn for longer than 15 minutes.
I'm having a hard problem with that.
I mean, I can remember in grammar school, I grew up next to the Arkansas River.
Okay.
I just daydream. I put all these limb lines in the river with crawfish and worms. I'm sitting all day wondering if I got a bite, if I got a fish, while she's teaching me who knows what. And I'm daydreaming about frogs and catfish.
Yep.
And they say, and then the scariest part of the whole deal is that kids all the way up to 18 years old basically don't code long-term memory till after 10 because they're tired and they're sleepy.
Sure, yeah.
And they didn't want to get up and go to school.
For sure.
And you woke them up because you got to get all these classes in.
Yeah.
And the teacher's saying, if you would have let them sleep in
right,
and come here fresh, and then when they eat, if they have caffeine, their attention span is cut in half. So here's some poor kid whose mom gave him Cocoa Cherry Pops and a Mountain Dew.
And they're already ADD to start with.
And he's got to compete with someone who had a toast and a scrambled egg and milk.
Yep.
And there's so much. So what you're saying about your online CE is that they get to go at their own pace.
They get to go on their own pace.
Now, what if they take the course but want to go back and miss something? How many times can they take the course for $95?
Well, so they get the kit once, but they can take off the dentistry they've done and they can redo that, right? So let's say
the didactic lecture.
The didactic over and over and over and over.
Unlimited.
Unlimited time.
So you buy the course, it's unlimited, so you would never have to take notes.
Nope, you can go back.
You could just go back. And a lot of notes that I do on online CE is I just take screenshots.
Yeah, and you can share with your team, right? One of the most, and we were talking about this, one of the biggest challenges, all right, you bring out a new product or new technique, you got to share it with your team. So if you are sitting down with your team, right, your assistants and in the front desk, well, this is why it's going to take me a little longer because this is how I want to do it so it functions better, it looks better, the patient's happier. All right, we're going to do this as a team together, and then you can watch it over and over. You bring in a new staff person, new assistant. Go watch this video. This is how we're doing this technique, right? So I'm going to pay you for an hour to sit down and take notes on this is how we do our technique.
So you're in tight with Brasler.
Yes.
Who's the president and CEO?
Larry Rose.
Can you fix me up with him?
I'll make a call.
I want him to come on the show. You know why I want him to come on the show?
Why's that?
Well, whenever you say group practice, people immediately start thinking of Heartland with 800 office,
sure.
DSOs, or Pacific with 500. But really, 80% of all group practices and associates are in private practice. Right. I mean, there's a cottage industry is any industry where one person doesn't have 1% of the marketplace. Right. There's 125,000 dental offices, and the largest dog, Heartland, only has 800. So Heartland would have to go to 1,250 offices, 50% more growth before you can have 1% of the market. Right. So when we talk about group practice, it's guys like when you and Buddy were group practice. And the number one logistics nightmare there is they try to set up a standard kit to do a posterior filling.
For sure.
And they can get doctors to agree on the gloves. They can get them to agree on the composite, the bonding agent. But when it comes to burrs, all hell breaks loose.
Yeah, right.
And when you are at Heartland, you have 800 associates and say, at Southwest Airlines, every plane is a
Exactly
Boeing
the same.
737.
Same plane.
And everything's exact. Can we just get you to reduce, for a posterior MOD composite, can we just get this down to like 5 burrs? And associates will walk.
Oh, interesting.
They're like, dude, if I can't have my this and my browser that and my brow, and it's like, so my question is, how many different burrs do you need before you're board certified neurotic? At this point, you need to see a doctor.
Yeah.
And how many? And to prove my point, how many different burrs does Browser have?
Oh, there's a million of them. There's tons of them.
I know.
Yep.
And it's a big, and then also, if you say, okay, I don't care, we're going to increase that. Everybody, we're going to agree in our practice, 10 different burrs for a crown prep. Well, if you only use 4 of them and you don't use the other 6, but we autoclave them all together. I mean, every time you autoclave it, you're breaking it down. So now it's crazy.
Well, I think
that a great answer might be, a lot of times the product innovation is not the innovation of the product didn't change. It was the packaging. Oh. Like milk. Nobody would buy milk because your car container was round. Ah. And when they started taking milk from square boxes to round holes, since every car has round and no one has a square, the packaged milk industry exploded.
Oh, interesting.
I think, for me, it comes down to sterilization. It comes down to the dispensary. I think the solution that Browser should do is, in a group practice, you're going to walk in the room to do a posterior crown. You walk in central sterilization, and here's this matrix of 100 different burrs. And you can just sit there and say, oh, yeah, I need this one, and this one. And then you, doc, crazy psycho that can only do it with these 3. And here you are, the most talented dentist on the earth, but you can't do a posterior crown with these 3 burrs. You need these 3 different, you know what I mean? Mm-hmm. So I think it's going to come down to packaging. I think the way they package burrs needs to be systematic. That way a group practice can say, okay, for a filling, a crown prep, a veneer.
Here's your set of burrs.
All 3 associates got together and say, okay, you know what our practice use? We use 57 different burrs. Mm-hmm. So let's give us a dispensing system so that the assistant, because it drives the assistants.
Oh, can you imagine that?
Shit crazy.
Yeah, right?
And then when you're in the middle of the procedure and you say, I need a 557. So what do I do? Take off my gloves? Do I got to open a drawer? Mm-hmm. Reach in there? There's errors. It's just crazy.
Yeah, for
sure. So you're the crazy man.
I am, yeah, a bit.
So you're the one that has to have these 5 burrs.
Yep. Mm-hmm.
So as you're walking in the room to go do a crown prep, you walk through sterilization and you just say,
yeah, and you make it so
and everyone's happy.
And you make it so you have to pay for them. So as the associate, then they're really feeling the pain, right? So
well, that's a great
little vending machine for your burrs.
That's a great, because a lot of dentists, they pay their associate like 25 or 30% of adjusted production.
Yep.
But the dentist pays the lab bill.
Yep.
And those doctors all have lab bills, 9, 10, 11%. But the doctors say, instead of paying you 25%, I'll pay you 30%.
You pay your lab
bill. But you pay half the lab bill. I'll split the lab bill with you. Oh, now all of a sudden.
Yep.
And it's the same thing with healthcare costs. When you look at these countries that brag that they have no co-payments for healthcare, their healthcare costs are high and their lines are very long. And then when you just come in and say, you know what, you just have to have a 5% co-payment. I don't care what it is. Utilization plummets for 5%. Right. And at 5%, when I have no co-payment, I don't care that a knee costs $50,000.
No, right.
But 5% of $50,000 is how much.
Now you got a little.
So now I'm calling Kansas City, Kansas, and I just found a lady that does knees for $45,000. Mm-hmm. And if I drive 2 hours into Jefferson City, there's a boy down there doing them for $38,000. Right. Just any skin in the game. And then you go into all the dental offices in Arizona where the dentistry is free. Mm-hmm. Because it's poor. Right. They're poor. Yep. They have a 50% no-show rate for the appointment.
Oh, for sure.
But if you sat there and said, no, your appointment, you got to give us a $10 bill to get that done. They clean up their cancellations. And then if you say you missed your appointment, to make another appointment, we still want that $10.
Yep.
They'd solve it. It's not about right and wrong. It's about managing people. Mm-hmm. And when people have no skin in the game, then they don't show up for their appointment. They don't care what the lab's charging for a crown.
Yep.
You need to have associates have skin in the game.
Hey, look, I think even...
And that would be interesting to have them pay. That would be so cool. How many burrs would they need? How would that number be reduced if they had to buy half pay for 50% of their burrs.
I think a
It
burr
cut 'em in
vending,
half.
a burr vending machine, I think, would be a.
That's what we need.
Yeah, right. Do they have to put in
So
a
will
credit
you
card?
get the CEO of Brasler to
I'll
email me,
talk to
Howard
them.
at dentaltown.com, CC Ryan Dentaltown, and tell him I'm going to tell him Howard's wish is a burr vending machine.
We'll let them know. I think we're onto something.
Yeah, and and you could make it really easy. Like it could be electronic.
Right.
You could just tell the doc, what does the average Brasler burr cost?
Oh, I don't even know, quite honestly.
What would you guess?
It's a few bucks. Got to be a few bucks, right?
Okay, so you just tell the associate, every burr, take any burr you want, use how many you want, but each one costs you a quarter. Or we'll split the cost. You have the price on the
Right.
deal.
Right.
And you come in there and you punch in, I'm Dr. Howie, and I use these 3 burrs, and I'm looking at these burrs like, oh my God, that big old football. What if this burr was $3.99 and this one was $1.99? And I have to pay half that burr. It solved the problem.
It
You
helps.
had doc to have skin in the game.
It helps, yeah. I think for sure. I think at all levels. I mean, education, right? My daughter's down at Tulane. She's got some skin in the game. I think that's all really, really important for people to appreciate.
Now,
what they're
Tulane,
doing.
is she in med school?
No, undergrad. She's a 4th year in undergrad.
You know what Tulane is the most famous for?
Well, their number 1 party school this year, which is a paying parent, does not really make me super happy, but it's a good place.
If you come back from Central South America with some weird parasite, fungus, infectious disease, you go to any hospital in the world and they'll say you need to go to New Orleans.
Oh, no kidding,
You need
really?
to go to Tulane.
Ha!
And if you Google on YouTube, do this. Google weird shit from Tulane.
Yeah.
I mean, like someone will come in and they got this big sore and they'll put like hot wax on
Oh,
it.
no kidding.
And all of a sudden a worm this long
No
starts coming
kidding.
out of this the cranium and ears and nose and I mean, there's shit in the Amazon that you couldn't even imagine how weird it is.
I have a friend who's had a derm down at Tulane. I'll have to ask her.
And this is way too much information for a podcast. But
well, at least it's not visual. We don't have to see that.
yeah, we all went snorkeling.
You can add that onto the.
I took all 4 of my boys snorkeling, and we came back, and everybody was just sick and not right. And we went to doctors, and no one knew. And they finally said, what you need to do is go to Safeway and order a bunch of whipped cream, the Cool Whip, and wash it all out, and then everybody poop in there and package it up separately with your name on it and mail it to Tulane.
No way.
And then a week later, they said, yeah, you all have a parasite that can only be killed with these mixture of antibiotics.
No kidding.
And they said that they would have never died.
Oh, no kidding.
They said they would have lived in your
Invasion
insides.
of the body snatchers, right?
Yeah.
It's coming out of your skin, yeah.
So if she's she's interested in healthcare, man, God, if I went to Tulane, I'd get into
She's
it.
not doing anything with healthcare.
Yeah.
She's going to work for the devil. She's going to go into marketing.
Well, how'd she get from Chicago to New Orleans?
So she knew she wanted to go into business. So she was down to my alma mater, Michigan, and Tulane. Those were the 2 schools that she liked most. And then, as it turned out, Tulane's a smaller school, and she had interaction with her professors. When she was applying, she could reach out to professors, they would actually respond, whereas at Michigan, they weren't responding. And then what really attracted her as a young millennial is sort of the social interaction that Tulane has with the city of New Orleans post-Katrina. So as a business student, they work with local businesses and their business plans. So she's in marketing, so she works with local businesses every year and works on marketing strategies for local businesses. So she gets real world experience on local businesses, and that really attracted her to going to Tulane. So it's been a really good experience.
It sounds like the apple did not fall far from the tree with that little girl.
Yeah, I think she's a bit of an entrepreneur, and she enjoys seeing businesses.
So right now you have 4 courses.
Yep.
Do you want us to wait to release this?
If you could, that would be great.
Sure.
Yeah.
Just tell Ryan when you want it released, and if you would you like it released how long? A month, 2 months?
Yeah, about a month, like right when we're getting ready.
And then
to,
how many courses do you think would be on there now? Then
Well, we're going to keep it to 4.
Okay.
We want to keep it to 4 because we're learning, right? We're learning what do people want to learn, and so that's going to help us sort of gauge which other courses we want to get into. But teaching dental students and young dentists has helped me understand what they don't know getting out of school. So we have a porcelain veneer preparation course that's going to be ready to roll, because I get that question all the time from my young dentists. How to appropriately cement an Emax crown. You wouldn't believe that's one of the biggest struggles, is that because dentists don't want to read instructions, right?
right.
So we're going to have a technique with they actually have a crown and they can cement. They'll have the model, they'll have the crown, so we can walk them through step by step what they need.
So do you know Rick Workman?
Oh, sure, yeah. Well, no, I don't know Rick Workman. I've met Rick Workman, and I know certainly who he is from Heartland and stuff.
Because I think one of the best marketing things you could do is you put one on Dental Town, and then say, you know, we got many more of these on this site. So it'd be like a content marketing. And then I go to Workman, who's got 800 offices, and Steve Thorne at Pacific Dental's got 500, and Rick Kirshner at Comfort Dental's got 350, because this is so affordable. And that's what they're supposed to be doing, is finding their doctors.
Well, we've beta tested with one DSO group in Chicago that has 30 practices.
Which one's them?
Decision One.
Yeah, we podcasted the CEO.
AJ's awesome. Yeah, so AJ Cerno has been a friend of mine for 15 years or so.
What a great guy!
Great guy. Great concept on his practices. What's great about our website is the administrator. We can make one of their head of education an administrator. So they can go onto the back scene and they can see who's actually taking the courses. They can see if they've actually skipped ahead on the videos. They can actually ask them to upload images. So as the DSO head, they can make sure they can calibrate their dentist to make sure that they're doing the procedures that they want to do. So for instance, a lot of their dentists may want to go out and do, say, Spear or Coys or DOS or whatever. They can say, look, that's great, but let's make sure that you're ready to take those courses, right? Let's get into make sure we have some basic building blocks. They can use it for interviewing. This is one of the biggest problems I understand, is that once these dentists are into these groups, how do they know what they're doing? So they can use this as an interviewing technique. Do these two techniques through DOT. We want to see what your results look like. Because if the dentist can't follow a video step by step by step and come out with a decent result, maybe this is not the dentist they want to be hiring. Right. So
Brasler is in all four of these courses, the package, because you need a burr to do this. So the one with BioHorizon, that's an implant company.
Yeah.
So it's an implant course?
Yeah. So we're doing the first course is a provisional of an anterior implant. So we have a 6-tooth implant model, BioHorizon implant, fixture analogs already in
provisional
the model.
What?
Provisional crown. For tooth number 8, I think it is.
Provisional crown on an implant.
And an implant. So we send the 6-tooth model, we send the temporary cylinder, we send the vacuform, we send the bisacryl, so they have their temporary material, and then they just follow along with me. This is how you do it. You try on your vacuform, you drill your hole through your vacuform, you put in your little stick. This is what you need to do. This is how you take it out. This is how you add to get the contour. This is how you support the soft tissue. And we go through all that. Then they screw it back in. So we've had great success. I beta tested all these courses I'm up at Marquette, so I'm working with a lot of the Marquette students, but I also do it with dentists themselves. Great feedback on all these courses, and that course in particular. The young dentists have gotten a lot of that.
And who saved Marquette Dental School?
Well, I don't know. I have my what do you say?
Well, tell me what your thoughts
are. I think Zachariason came in, and I thought he, there was an interesting time. So
because remember that they were going to close down the school.
Shut it down. Sure.
What year about was that?
That was it's got to be about 12, 13 years ago.
Yeah.
Because the old structure was 100 years old, and it didn't allow them to do the things they needed to do.
But who saved it?
I don't know. Tell me.
Do you remember Lord's Dental Studio?
Oh, sure, yeah.
And the owner was Rennie Schellner.
I know the name, but I don't know him.
He knew it was going to close, and he was hearing all the deals, the government, the Jesuits, all these things like that, and he was the man who found out what the problem was, who needed to be there, got them all in one room, shut the door, and said, "You're not leaving till we save this damn dental school." And when you talk to anybody, they say, "Well, I got a call from Rennie Schellner." Well, I got a call from Rennie Schellner.
Oh, interesting.
He got everybody that could make a decision to solve the damn problem.
Yep.
And one dental lab saved that damn dental
that's
school.
Fantastic.
And if you don't think it was a verge of shutting down, how many dental schools have you and I witnessed shut down in our years? Georgetown,
Fairleigh Dickinson,
Farleyson, Northwestern,
Loyola, Chicago. Yeah, I mean, there's at least 10.
What's the one in Atlanta?
Emory.
Emory.
Down, yeah.
I mean, dude, if you say, "Oh, they would have never closed it down," we've seen 7,
10.
8.
I think there's 10 dental schools.
Yeah, we've seen 10 dental schools go down, and there's only one dog that saved that school. And that was
that's interesting.
shout out to Rennie.
Yeah. Oh,
and Which I personally don't like Rennie because he's one of those cheesehead Brett Favre fans, and I've tried to convert him to the Arizona Cardinals for almost 30 years.
It's in their blood. That cheese is in their blood. They got cheese curds in their blood.
They got cheese curds in their blood. So this is Dentistry Uncensored. I want to ask you some tough questions.
Please do.
What do you think your number one expertise is? And I always thought of you as a composite. That was your, I mean, where you're the Rolex Mercedes Elite. Would you say it's composite?
Well, I think my expertise is communicating with dentists. I think that I think I teach really, really well, and I think I help dentists get better.
You do? I've seen you. I was guessing.
There's much
4
better,
to 6 times.
There's much better clinical dentists. I mean, go on Instagram or Facebook. There's some guys.
But as far as the knowledge of composites and bonding and cement, I mean, you're pretty elite.
Well, I got a good knowledge. I got a great foundation.
So let me ask you some of the Dentistry Uncensored politically incorrect questions.
All right, please do.
30 years ago, Delta, you just would submit your fee and they'd pay 80% of it for a composite. Mm-hmm. So you could raise high fees, do all this layering stuff. You could spend all day and all night because you could set your own fee.
Yep.
Now, Delta, when dentists, I mean, what percent of dentists take Delta? According to Delta's website, 95%.
Yeah, which is not true.
Okay, but there's a lot of dentists on a PPO.
There are.
And so if you're going to give me less money, I got to go faster.
Yes,
so these bulk fill, instead of layering and bonding and layering them, these bulk fills, it's like you want them to be good.
Yes.
You want to believe it.
Yes.
Because it's so much easier just to squirt it one time and cure it and be done.
Yep.
So what's your thoughts on these bulk fills?
Yeah, so
will you have any courses coming up on bulk fills?
Yes, we will have courses on bulk fills. Bulk fills are helpful, for sure. You know, the limitation of a traditional composite, you can cure through 2 millimeters. With bulk fills, you can cure through 4 millimeters. They do that by a change in chemistry, and they also do it by making the material more translucent. So the advantage of it is you can put in a big amount of composite, cure it all at once, and then typically what I will do is then I will layer over top of that with my traditional nanofill. So instead of having to
when you say nanofill, what is a nanofill? What is the brand names of?
So there's a bunch of nanofills.
And by the way, I always ask that because my number one complaint is always saying when some guy will say, "Well, I use a composite." They don't want to hear you use a composite. They want to know the name of the damn composite.
All right. So there's 3 composites in our marketplace. There's microfills. Cosmetic makes the industry leading material. Their Renamel microfill is the best microfill out there. Microfills give you the advantage of polishability, stain resistance, most enamel-like material. Microfills are meant for anterior composites. Class 4s, veneering, Class 5s, I use them nonstop for that. The downside with microfills, they chip more because they have poor flexural strength. So you need to have your microfill supported either by tooth structure or a stronger composite like the microhybrids that you and I grew up with, and then more recently introduced the nanofills, which are a replacement for the microhybrids.
And a lot of the most elite cosmetic dentists, like Bud, you call it Cosmetic, is that yours? Did you and Buddy do that?
No, Cosmetic is all Buddy Moppers.
But who's that famous British cosmetic dentist?
Jason Smithson.
Yeah, he loves Renamel.
Yeah, well, it's the microfill.
Do you ever talk to him?
Jason's a very good guy.
I've been wanting to podcast him for 1,000 days.
He's a fun, interesting guy. It would be a riot.
And if I got a hands-on course from him, and another one for you, I think I got one from him, but it was like 10 years. Do a search for online C for Jason
Smithson.
Big
townie. Jason Smithson, I think, made his career by going through Dental Town. He's an electric personality. He's a phenomenal dentist, and he really works well in that medium.
Last time I saw him lecture was in Belize.
Oh, is that right?
It was at the Michael Melker's.
Oh, sure, yeah.
Belize deal, and took the boys there. That was a blast. It was unbelievable.
Is that where you got your parasites?
No, that was Cozumel.
All right.
Scuba diving.
Yeah.
But I have dentist friends in New Orleans, and every once in a while they'll text me a video that they got from one of their physician buddies, and you would think it was literally like black magic voodoo. I mean, they're pouring wax over stuff so this thing under her skin starts to suffocate, so it finally shows its head, and you got to grab it with the tweezers right when it sticks its head out. And some of the craziest stuff
I don't like that stuff
you'd ever see in your life. Okay, so you talked about microfill, renamel.
Okay,
Jason Smithson loves it. Anterior stuff, direct composites, which is far better than indirect veneers. Okay, and then
Then you have two other groups. You got your microhybrids, which came out like the late 80s. This is all the materials that you and I used to use. That would have been like Herculite. Remember Herculite?
was that Herculite was
Was Kerr's product, right?
was it Holzer, Kerr, or Holzer?
Herculite, I think, was Kerr.
Okay.
And then, I mean, they all
You're right.
of them had it. Renamel had their, and Renamel still has an excellent. Cosmetic has their hybrid, which is a great material. The advantage of the microhybrids, before those came out, they had what were called true hybrids, which were large particles. They were greater than 1 micron. They stained really poorly. They were wore down. They were a good start, but they weren't great materials. So the microhybrids replaced those. What you found with microhybrids is they didn't maintain their polish very well. So they came out and they told us this is a universal material. It's as strong as a hybrid and it polishes like a microfill. Neither were true. They were strong enough, but they didn't maintain their polish. These are the materials people would come in, they do class 4, they do a class 5, and the patient would come in and say, why is it staining or it feel rough, right? So they just lost their polish right away. Then about 10 years ago, nano composites came into the marketplace. Nanos essentially replaced microhybrids. They're almost as strong as microhybrids, but they polish much better than microhybrids.
And you call them
Nanofill composites.
Nanofill, which really replaced microhybrids, not microfills.
Right. They told us they were the universal, that they would polish as well as the microfills and as strong as the microhybrids. Neither are true. They're not as strong as microhybrids, but they're
okay,
strong
well,
enough.
she wants to know, she's trying to work, she wants to know, what do you use? When we're talking about dentistry uncensored, 25% of them are still in dental school.
Yeah, sure.
And the other 75% are all 30 and under.
Yeah,
How old's your daughter?
21.
Yeah. I don't have a 55-year-old dentist friend in Phoenix that even knows. If I put a gun to my friend's head and said, download my podcast,
right,
I'd have to shoot every one of them.
Sure.
So it's a millennial deal.
Yep.
So they
go
to the lecture and everybody's talking about all on 4, and they're like, damn it, I want to do a single
one. I want to do one. I just doing one.
And when you look at hundreds of millions of insurance claims
Yep.
on the 32 teeth, it's just like nothing. Then the 6-year molars, boom. 6,
Sure.
3, 14, 19, 30. What's the tooth most likely to get a restoration? First molar.
Yep.
Most likely to be root canal, first molar.
Probably lower
most
first
likely
molar.
to be crown, first molar.
Yep.
Extracted, replacement implant. So it's 80-20. It's like all the dentistry they're struggling with. They got out of school. They're trying to get down. They're filling their crown.
Yes.
Their disc. So I'm gonna beat you up right now.
Yeah, no, do it.
An MOD composite
Yes.
on any first molar.
Yes.
How do you do it?
What I do, so I believe in the bulk fill. Here's the thing with bulk fill, though, is that the challenge is making sure that your adhesive is properly light cured, right? If you have a poorly light cured adhesive, then you got a crap bond and you got a failed restoration. So what I do is I use a core material. I use Cosmocore. I'm a Cosmetic guy, but that's
Cosmocore. Now, is that a microfill or
no? It's a microhybrid.
It's called Cosmocore,
Cosmocore, COSMECORE.
and it's a microhybrid.
Yeah, so it's a core buildup material. It's a dual cure material.
Nice.
I like that because I don't have to light cure my adhesive. I have a dual cure activator. I etch the tooth, rinse off my etchant. I go through my
Total etch the tooth.
Total etch the tooth.
Okay, total etch.
Rinse off the etchant. Take off the excess moisture. So suction off the tooth. Use a multi-brush to dab off the extra water because you don't want to have pools of water there because that will dilute your adhesive. So I'm going to dab off the extra moisture. Now there's a 2-part adhesive because you have to have a catalyst. I don't want to light cure it. I don't want to light cure it because I don't know I can get my light 7 millimeters down in that box and have a great cure, right? So I do a dual cure activator, put it in, several coats, air thin it. I inject my Cosmocore. I fill it till it's about 1 millimeter to 2 millimeters from the occlusal surface. Light cure it all at once. So I got my MOD, right? Except for the final surface. I light cure it, After I licure it, then I'll take a nano composite. I use the nano composite from Cosmetic. It's a Renamel Nano Plus. And I will do...
It's Renamel Plus?
Yeah, they call it Nano Plus. Renamel Nano Plus.
Okay.
So
and
Renamel,
that's your top layer?
That's my top layer. And that gives me the best...
Top layer for a posterior, not for an anterior.
Right, exactly. Okay. We'll talk about that for the anterior, but for the posterior then, I built up this MOD, except for the last little bit, and I can literally do a cusp, inject. It takes me 10 seconds to make it look like a cusp. I just take my instrument and I just blend it over the cusp. Licure that for a few seconds. Do the next cusp. Licure for a few seconds.
So is one of your courses a posterior MOD composite?
It will be, absolutely, yeah. Not yet, but it's going to be coming down the road.
Okay, now on this implant, can we switch to the Bio Horizon course on the deal? On the implant, here's what she's telling me. She's saying in America, all the implant training is tied to a manufacturer.
Sure is.
So I have to pick what implant I do first. So what implant do I pick?
Yep, for sure.
Number two, all the implant people say the implants have a 98% success rate, and any basic literature search on Medscape says that in 5 years, 20% have periimplantitis, and in 9 years, like 30% have periimplantitis, and at 14 years, 40% have periimplantitis. So she's like, well, am I going to really extract this tooth because it has gum disease?
For sure.
To put in an implant that has a 98% success rate, whatever the shit that means, but have periimplantitis in 60 months.
So you got to define success. What is success? So if the tooth is still in the mouth, then is the tooth successful, even if it has a 9mm pocket? So if an implant is in the mouth and it has periimplantitis, but it has pocketing, if it's still in the mouth, it's still successful. It's still in the mouth. That's at 98% success. Managing implants is far different than managing teeth. Teeth die a slow, awful death, right? I mean, it'll be perio for a long time. You manage it. Perio is like a nasty death, right? And it can go much more aggressively, much more difficult to treat. So, yeah, that's a big issue for sure. How are you going to manage that? And I think those numbers are all real sort of...
Well, it's one thing I've noticed, it's always a pendulum. I remember when I got out of school, you were doing quadrant perio surgery and root amputation. You were doing everything. And then all of a sudden everybody said, screw this. We're going to treat this with extraction and titanium. We're just going to pull it. Now I'm seeing the pendulum coming back. The old school periodontal procedures, because I think this panacea that I could just wave a magic wand, throw the tooth away and stick in titanium didn't turn out as fairy tale as everybody thought it did. So would you agree with that?
Yeah, for sure. But interestingly, I took an Uber in from the airport last night. It was like midnight, and I had a real nice Uber driver. I'm chit-chatting with him. He asked me what I'm in for. I'm talking about this dental podcast stuff. He goes, I just went through some dental surgery myself. This is a young guy, 40 years old maybe. And so he just had all-on-4 upper and lower because his teeth have been a misery his whole life. He's always had problems. So he said, I saved for 3 years to be able to afford it. And over Christmas break, he had all his teeth slicked out. He had all-on-4 upper and lower. He's in his provisionals, and now he's getting ready for the finals. And I said to him, you got to be careful. If your teeth failed like that, same thing can happen with your implants. You won't get decay, but you're gonna, you have to be worried about caries. A smoker, I said, man, you got to take better care of these than you do your car. And so I don't think that they understand the disease that can happen to implants and the destruction to the bone when disease happens around implants.
But the thing that upsets me about that I love that story. It's a beautiful story. But what upsets me with the millennials is they'll go to Chicago Midwinter. Mm-hmm. They'll go to and they'll have all these lectures on all-on-4s. Mm-hmm. And none of them will do one. They'll go back home and they work at Aspen and they do all on nuns.
You're right, yeah.
And when they go to online CE courses, I can get 100 dentists to build Dental Town an online CE course on placing a dental implant. I can't find anyone to make me one to make a denture. And so when you're in real world America, like right. I'm in Phoenix, I'm across the street from the Guadalupe Indian Reservation. Mm-hmm. Guess how many all-on-4s they had last year? None.
Yeah.
Guess how many all-on nuns they had last year?
Lots.
And then she's sitting there, she's 25 years old, and she did one denture in dental school.
Right.
That's what she got for
sure.
$300,000 of student loan debt.
Absolutely, yeah.
And and that's the challenge that I always trying to get amazing online producers and lecturers like yourself is that bring it back to the hood for the people that just walked out of dental kindergarten. They need a course on a damn denture. They want courses on how do you go from placing 0 implants to 1.
Right.
It's pretty easy to teach someone to go from 100 to 101,
Yep.
or 1,000 to 1,001. But you know how hard it is to be 25 and go 0 to 1. And then I go watch this all on 4 course, and then my next 10 patients I present that $25,000 an arch to.
Right.
And in Phoenix, Arizona, they say, okay, that's great, but I don't know if you noticed, but I'm not Tom Hanks. I just want to pull out my denture.
That's the reality.
And she's like, wow, I made 1 denture. And how did we do that again?
Yep. Yeah, for sure. I mean, BioHorizons, our conversation, one of the first courses they want is a locator course, because they realize that is that's when I'm talking to manufacturers, I ask them, what is your biggest problem? What problem can we solve? Because I believe dental online training should be the intermediary for corporations and dentists. How do we get dentists to use your products better so the patient can have better care? I'm not here to tell manufacturers how they should be teaching the dentists. I want to be the conduit to get the information from the manufacturer to the dentist so they can do better treatment for their patients, have more confidence when they're going in to do their treatment.
And you know, it's funny, when we started Dental Town, I owned Dentist Town, and these dentists would get all mad and they say, well, this guy came on and he owns a company and he's trying to sell stuff. I'm like, oh, so what are you, a volunteer? So you sit in your dental office doing free dentistry all day?
Yeah, it's kind of
Do
crazy.
you think I could be an amazing dentist if I didn't have 500 dental companies like Brasler and BioHorizons and CAD Cams? I mean, if you took away all the dental manufacturers, we'd be sitting on a rug outside with shit we bought from Home Depot.
Yep.
And it's our number 1 complaint on Dental Town when you hit a report abuse when you don't like a deal. It's always because, well, I actually work at XYZ company and our top selling product is this because of the problem you just said. Oh my God, you're trying to sell something. It's Lucifer's brother. You know, it's like, it's not Lucifer's brother. He has passion. Dental Town is for anybody who spends their whole life in dentistry.
Right.
And some of the most passionate people in dentistry are a lot of manufacturers.
Yeah, sure. Yeah.
They spent their whole life trying to put a better, faster, higher quality, lower cost product in your hand. So we all treat the same patient.
Look, if we didn't have all that, then you're right. We'd still be using rocks and chisels to fix teeth, you know? I mean, it is that competition of manufacturers trying to do it faster, better, improve the access to care, improve the care that we do. You know, you brought up with people who are stuck in, are doing a lot of medical insurance programs or dental insurance programs, how do we make the dentistry that we're doing better? And that's so one of our courses is like, all right, how do you do a class 4 composite if you're not going to be using opacers and you're not going to be using tints? How do you make it look good if you're just using a nano-fill system only? How do you make it look like a good restoration? This is what you need to know. This is how you create your bevel. This is how you layer it. And you can use these 2 composites, and it's not going to take you any more time than if you just use 1 composite, but you're going to get a much better restoration. But this is what you need to know how to do it. If you want to be able to do layering, where you're doing opacing, tinting, microfills, all that, we'll have those courses too. But if you need to know how to do the basic courses because you can't charge as much, but you still want to do good dentistry and still want to have a happy patient, this is how you do it.
But back to that implant system, Chicago Midwinter's coming up.
Yep.
She's going to drive in from Green Bay or Milwaukee. How many different implant companies are going to be down on that floor?
Dozen.
So she's 25. We're in our 50s. Give her a break. How did she pick an implant?
Yeah, so I think that the challenges and what I found is that typically when restorative dentists, general dentists are doing the implants, it's based on what the surgeon wants to use. This is what they like. And I always felt like it was directed by the surgeon. My goal in teaching these restorative courses, first of all, I like BioHorizons. I like the people I get to work with. But I want dentists to be able to understand the techniques. All right, this is how I make a provisional. All right, now that I know how to make a provisional, and I have this implant specialist who's using BioHorizons, I have this implant specialist that's using Straumann, Astra, whatever, they do the same technique. So now that they know the technique, they can figure out which system fits best for them. So when the implant surgeon says, what implant system do you like? It's the same way to do it, but now they've worked with all the parts and they say, this is the one I'm most comfortable with. right? These are what I have. I have the driver for this
You
system.
said Aztec?
Astra.
Astra, that's
That's an
by
implant
Serrano?
company. Yes.
Astra.
So Nobel, all the big players are.
But name all the big players. Because the one thing that older guys can tell you is you don't want some small company because then 5 years later they're gone.
Yeah, I think that's
And
the
you
truth.
don't want a company with no research because then if you do a big case, and I'm saying a big case is 10 to 50,000 and it fails, and she goes and talks to a malpractice attorney, and then he's saying, you use ABC implant. Can you show me the literature? So you want a major
Yep.
that you know is going to be there in 10 years and does their own research. That'd be Straumann, Noble Biocare, BioHorizon, Megagen, Astra. Who else? Just shorten the list.
Boy, you got me. I mean,
Straumann. Zimmer.
right? Straumann. Do we say Straumann?
Yep, Straumann. Noble
3i,
Biocare.
3i, right?
Well, 3i was
Biomet.
bought by Zimmer.
Right. All right.
So 3i is Zimmer.
I mean, I think those are the big guys, right?
So it's pretty much just Straumann, Noble Biocare, BioHorizon, Megagen, Astra, Zimmer.
Yeah.
Am I missing anybody?
I think that's the big players.
Yeah. So that's, you got it down to 6. And then my advice after that is, why are you flying across the country to learn how to do implants when your periodontist is across the street? And half of the periodontists think in fear and scarcity and say, well, no, I'm not going to teach you implants. You don't know how to do implants. That's how I make a living and feed my family. You refer me the implants. Okay, that's an idiot. The next periodontist say, well, hell yeah. Because they know you're in dental kindergarten and you're going to try to do some singles and this and that, and you're going to give him the ones that you don't feel comfortable doing with.
sure.
It's the same thing with orthodontists. The biggest orthodontic practice I know, half of them think in fear and scarcity and like, oh my God, you're doing Invisalign. That's my department. Shit, dude, Invisalign has already dumped the orthodontist and bought Smiles Direct Club, a big chunk of that, and now you can go into a kiosk and have no one in dentistry do the
Right.
scan.
Yep.
They send it to Costa Rica where they make the clear aligners.
Yep.
So now Invisalign is telling the orthodontist, we don't even need you.
Yep.
And now you're the orthodontist saying, I don't need this young 25-year-old girl dentist across the street. The only orthodontists I know that are doing $5 million a year or more, they tell every dentist within a 20-mile direction, hey, I got a free Invisalign study club last Thursday of every month. Bring your cases. I'll teach you. Because what did they all learn? Within a year or two, you're bored with Invisalign because, when you do a crown, you're done in an hour. When you do an Invisalign case, you're married to it for 2 years.
And you're married to the patient forever with that.
Yeah, and number two, there's going to be all these other ortho cases that you don't want to do. So the people who always think in hope, growth, and abundancy grow. Same thing with that dentist across the street. The dentists that walk across the street and press the flesh with the dentist across the street, and you're not competing with that dentist. You're competing with $1,000 iPhones and Disneyland and
That's the truth.
cars and clothes, and it's not the dentist across the street.
I agree.
And it also gets rid of a lot of lawsuits. I can't tell you in 30 years how many times someone will walk in and say, I'm going to sue this guy. Look what happened.
Sure.
And then immediately you just say, well, okay, I'll put out the fire
Yep.
if you just leave the last guy alone. Because
Yep.
he's a really great guy, and let's find out what's wrong. Then they do that to me.
Yep.
And you got each other's back, and they're getting they don't realize they're getting second opinions from your alcoholic drinking friend who you've eaten 4 million cheeseburgers with.
Right.
And they're like, Howard, he messed everything up. And this guy's thinking, yeah, we're going to be doing shots in about 2 hours
Yeah,
now
that's
at Brad's place. So one last thing about your temporizing a crown. A lot of people think that it's actually the cement that's causing peri-implantitis.
Right. So cementosis, right, as the cement gets leaked down onto the implant. So with the provisionals especially, I think you need to be able to contour the tissue, and the only way to do that is through a screw down technique. And so that's the technique that we teach, is how to contour the provisional so it will support the tissue. We go through in the lecture portion, all right, if you're adding here, this is what you should suspect from the soft tissue. So if you're trying to raise the soft tissue, this is how you want to contour it. If you're trying to drop down the soft tissue, this is how we want you to subgingival contour. But it's all screw down so we can avoid having cement, especially at that stage.
Okay, and you only weaseled out of one question.
Which was?
How many browser burrs do you need on that that cart before you're neurotic and psychotic and need mental help.
I think the person who needs the therapy is my assistant for trying to get my burrs organized.
Hey, Dennis,
I think it's part of the artistic aspect of it, right? You have
I've been a huge fan of you and Buddy Moppert and Jason Smithson. Who's the other guy? Is it Corky White?
Corky Wilhite, who I taught my first hands-on course with at Cosmetic 20
my
years
two
ago.
biggest podcast wishes are Corky and Jason.
Oh, Corky's great.
Can you help me line them up?
Oh yeah,
we
for
can
sure.
do it over Skype.
Oh yeah,
for whatever.
Sure. Yeah.
I've seen those guys all lecture many times.
Done. Yeah, that's no problem. They're great.
You know, a lot of people say, this is my last thought, that corporate dentistry is going to take over dentistry. And, you know, when we were little, every pharmacist owned their own building. Now they all work for CVS and Walgreens. And then I go in there and I look at dental associates. Mm-hmm. The average one only stays 1 or 2 years. They hate it.
They hate it.
I never heard anyone say, oh, my God. And it's not anything. And when I say that, I'm not talking about Heartland and Pacific. I'm talking 80% of associates work for in the private sector. Mm-hmm. Not even 20% work in these big DSOs. And it's not just in dentistry. When you go to the stock market bubble, Fang, Facebook, Apple, Amazon, Netflix, Microsoft, Google, their average millennial only stays 1 to 2 years.
Right, and then they're off.
So, and you hear all these stories about Google making the work environment with beanbag chairs and foosballs and free healthy snacks and yogurt and all this bullshit. They still can't keep any of it.
They can't keep anyone.
Because at the end of the day, the human doesn't want to take orders. Why do kids leave home? Because they want to do stuff that dad was actually not letting his daughter get drunk at home every night.
We try to avoid that.
So she left him and went all the way to New Orleans. That's human nature.
Right.
Human nature is, I wasn't born to be told what to do by you.
Correct.
And as you get higher educated, like I asked every 3-star general that had been in my practice in the last 30 years. I've had a 3-star general in the, I think in the Air Force, a couple 2-stars in the Army, a 1-star in the Marine, because we're in a retirement center. Mm-hmm. And I said, they said, the deal with managing military is, you want a bunch of very young boys. Yeah. Because if all the boys were 30 or 40, they wouldn't follow the orders.
They wouldn't do it, right.
Sure. When you have highly educated people with 8, 9 years of college, it's like herding cats.
Yeah.
So you're working at corporate. If you think the burr issue is a problem, just go to private practice. Just go to private practice, and you're going to be fine. What advice would you give her? She's driving to work. She freaking hates her job, but she's just scared. It's fear.
Yes, fear, absolutely.
Of pulling the trigger.
Sure is, yeah.
Open up my own shop.
Well,
that'll be your final thought.
My final thought is I do believe there are people who are entrepreneurial in spirit, and I think you have to be entrepreneurial if you're going to open up your practice or you're going to be solo practice. You got to make tough decisions, right? How are you going to lead your practice? How are you going to manage? How are you going to train your team, and how are you going to continue to get educated? If you're not entrepreneurial, I don't think there's a problem at all with working for a group. But for people who are entrepreneurial, you got to be brave, right? You got to be able to look past the fear and have courage. And that was a message to my team at our end of the year meeting was have courage. Have the courage to tell the patient this is what you need to do. Have courage to tell your teammate, hey, when you said this is how I felt, right? Be courageous, and that's what I would tell young dentists. Be courageous. We've all gone through this. We've set the path. Continue the path. You can do that. You just need to have courage.
And address this mental block she has. She's 25, and she's a human.
Yep.
And a functional human has empathy and sympathy.
Yep.
And if you don't have empathy and sympathy, you're actually a sociopath.
Yeah, right, exactly.
And she just wants to do 1-2 dentistry because she doesn't have the heart to tell you have 11 cavities. Right. And she's like, well, I can't go tell dentist he has 12 cavities. Maybe we should just do the one he's pointing to. So they go through 1-2 dentistry.
Yep.
Then they evolve up to quadrant dentistry.
Yep.
And then they eventually move up to full mouth dentistry, because a lot of times they'll say, well, I can't hem up all 4 quadrants. Really? The guy next door to you is an oral surgeon and numbed up all 4 quadrants. Right. And if you ask me, do you want to come in 4 different times to have 4 different quadrants done?
Or just
Hell no.
Just get it done.
I mean, my next surgical procedure is a colonoscopy. What if he came in and said, well, how about we'll go up halfway the first visit, then next Thursday you can come back and want, no, just So how do you coach your, as a father with a daughter,
Yep.
to be able to look a man in the eye and say, dude, you have 12 cavities?
Right. I think, first of all, you got to ask
do you
permission.
agree that this is an emotional
100%
problem?
agree, and I think you have to ask the patient for permission. I need to talk to you about what I see. Can I have your permission? Is it okay if I show you? Because you've talked about this, about the value of intraoral cameras, right? Mm-hmm. It's one thing to tell patients, you have to show them. You know what? And if you don't have an intraoral camera and you can't get an intraoral camera, pick up your damn iPhone, get a mirror, and take a photograph and blow it up on the screen. Look, you don't have to get so complicated. Show them what the problem is, right? And holding a mirror is 1970s dentistry, right? I say, get your camera out. I teach the dental students, use your iPhone. Take a photograph. Show them this is the problem. Help them understand, and then let them make the decision that's right for them. This is what I see. How would you like me to take care of it? This is my recommendations. And I've told patients over the years, look, you got 20 more years till I retire. You got 10 more years till I retire. And I tell patients, you don't have to decide today. It's your mouth, your teeth, your money. You tell me when you want me to do it. I'm showing you the problem. You let me know when you want to do it. I'm here until, whatever year.
But the number one fear they have is rejection.
You're not rejecting.
So if I tell you have 14 cavities and you reject me and don't do it and walk out, I feel horrible.
Well, I think that's because they're putting themselves in the position of making the decision for the patient. What they have to do with the patient, I think, is to share with them what their findings are. Then it's the patient's decision, right? Here's what I see. Here's how I would fix it. What would you like to do? That's it. And if the patient says, I don't want to do anything right now, that's right. If they have a car that the engine light comes on and they decide not to do anything because the engine light came on, are they a bad person? No, they just decide to ignore the fact the check engine light came on. They can wait until the check engine light goes from yellow to red and then deal with it. It's their car, it's their money, that's their problem, right? That's how their teeth are. We're there to educate and tell them, inform, and support them with their decision. And I think to do otherwise, to judge them for making a decision that you may not make, I think that's immoral. I think that's wrong. It's their decision, their money, their mouth, their teeth. I am there to guide them through the process. You do what you want to do. You know what? Don't call me, though, at Friday at midnight because the tooth is hurting that we talked about, right? There's got to be that agreement. But it's their money, their mouth, their tooth.
You know why I quit flossing?
Because
we're my favorite bar. They never make it medium rare. They always make it well done.
All right.
So when they make it well done, that's when I floss. Then my mouth fills up with blood, and then it tastes like I'm eating a medium rare.
I like it.
Was that
That's
smart?
A good idea.
Was that
That's
a good idea?
I like that.
So stop flossing if they're
That's
overcooking
good.
your steaks. Thank you for all that you've personally done for me in the last 30 years. Thank you for all you've done for dentistry. Dennis, you're a rock star. Thank you so much for coming by.
Thank you for having me. This is what a great time to be able to sit here with you and talk about what I've done for dentistry, what you've done for dentistry. That can't be measured, and so I'm grateful to be here. It's been a great time.
Well, actually, everything I did for dentistry was invented by Al Gore, so we just have Al Gore to thank for inventing the internet.
To take care of that global warming.
Okay. And by the way, that's a bad joke. I hate saying that joke because the truth of the matter is if you go in and look it up, he did a lot of massive infrastructure deals for the backbone behind the internet.
Oh, I didn't know that. Oh, I'd never known that.
When he said that, he shouldn't have said it the way he said it, but if you historically look at what he did, it's the worst joke in the world because he have everybody in the government at that time, he did the most
no kidding.
to spin the internet down the street faster.
Oh, how interesting. That's so funny.
I feel bad for saying that joke.